A very good evening to one and all. Welcome to the webinar series by Dr. Shika's NutriHealth. And in today's webinar, we are going to be talking about role of diet and nutrition and in infertility treatment. And for the today's webinar, with us, we have Professor Dr. Abha Majumdar. She is the director of Center of IVF and Human Reproduction at Sir Gangaram Hospital, New Delhi. She comes with an experience of 39 years in handling infertility and complex cases of IVF. Right? She did her MBBS from SN Medical College, Agra University, and her MS from SN Medical College, Department of Obstetrics and Gynecology. Right? And further, she did a fellowship, FICS fellowship granted by International College of Surgeons, India section. Her fields of interest are infertility, ART, which is assisted reproductive techniques, reproductive endocrinology, endoscopic surgery for pelvic resurrection. She has won a plethora of awards. Just to mention a few, she has received the President's Medal for Best Medical Graduate of Year 1970-75, Vikas Rattan Award by National Economic Development and Growth Society 2002, Lifetime Medical Excellence Award OBGYN by Hippocrates Foundation 2014, Abdul Kalam Medical Gold Medal 2015, and Rashtriya Gaurav Gold Medal 2017. She was also awarded the Distinguished Teacher of Excellence Award by PG Medical Education in BAI and National Board of Education. She was also awarded the Economic Times Icon of IVF of North India 2019, and she was awarded the National IVF Champion of Year 2019. She is also a member of editorial board of IVF Worldwide, peer review of Journal of Human Reproductive Sciences, and member of advisory board of Journal of Fertility Sciences and Research. Welcome, Dr. Abha, to this webinar.
Thank you, Nitin, for being able to read out all the difficult scientific words. I know how difficult it is for a non medical person to read out all the silly, long, cumbersome words you just pronounced. Thank you
Thanks,
very
Doctor.
much for having me over on this digital platform, Shikha, and the whole team.
Yes. Before we start the webinar, let me also give a quick introduction to our viewers to Dr. Shikha as well. Dr. Shikha
Yeah,
came as medical doctor.
I wanted to just share that Dr. Abha Majumdar is an icon in herself, actually, and most people in the medical fraternity, for them, she is a role model. Yes, today we have a lot of general, are concerned. She herself is an icon.
Thank you, Shikha, for the nice words. I think, Nitin, please go ahead with the
Right.
introduction
Let me
of
just
another
introduce
very
Dr.
big
Shikha.
personality. Yeah.
Right. She is a medical doctor by training from Maulana Azad Medical College, New Delhi. She founded Dr. Shika's NutriHealth with a desire to work in the prevention of lifestyle-related disorders. The organization is a pioneer in integrating modern nutrition with Vedic nutrition and serves clientele across the globe. She has built a telenutrition center and a personal health app, Vedic Diet, which helps in delivering personalized advisory and compliance monitoring, another pioneering concept introduced in the area of wellness. Dr. Shika had a weekly column for 11 years in the national newspaper ST Brunch. She has also been quoted by several leading newspapers and magazines like Times of India, Femina, Cosmopolitan, Huffington Post, etc. Dr. Shika appears regularly on television channels like NDTV, CNBC, Zee Business, and is invited frequently to give talks to Economist Magazine, ASSOCHAM, All India Management Association, etc. She also delivers lectures to the students of top engineering and management institutes like IITs and IIMs. Dr. Shika was written about by the India Today in its article Top 50 Young Achievers of the Country, and she's also empaneled as a lead expert with FSSAI, Food Safety and Standards Authority of India. She has been the health advisor to many celebrities, hoteliers, chief ministers of Indian states, and one late prime minister, amongst others. Welcome, Dr. Shika.
Thank you, Nitin. And firstly, I think I would like to mention that today there are so many young couples who are desiring to have a baby, and because this is something which is you can say a baby is a gift from God. But due to many reasons, some couples struggle with infertility, and then they look for information on what can be done, what should be done, and many times the couples are hesitant to really inquire, and many times they do not have the right information to make the right choices. So I'm so glad that Dr. Abha Majumdar is here, who has so much of experience, and not only experience, the compassion to help people, to help couples who really want to have that gift of God with assisted medical care. So, Dr. Abha, welcome. So, my first question to you would be that, is there a rise in infertility globally? Is it, or is it just that we are seeing more cases in certain areas?
Well, both things are true. There has been a rise in cases of infertility, as well as we are seeing more cases also, because now there is treatment available for conditions which was not there earlier, say 20 or 30 years ago, or at the time when I passed out. There was no IVF. IVF has revolutionized the history of reproduction. Like, old couples who were thought can never conceive have been able to conceive through IVF. And in fact, it used to be the last choice once upon a time. And now it has started to become the first choice. So, development of IVF, development of laparoscopic surgical corrective surgeries where we do pelvic resurrection for a woman who has a lot of problems in her pelvis, helps her to conceive naturally. Plus, the development of gonadotropins has given us a way to stimulate the ovaries of women who would not be able to ovulate. So we have so much now available that people are now aware, and they've started coming forward, who used to just sit backward and think that this is their destiny, that they cannot have a child. But then on the other hand, like you say, there has been a rise, true rise, and this comes with overcrowding, pollution, lifestyle, overeating, or undernutrition, and possibly sexual habits also. So there has been a rise for men also and for women also.
Correct. So, though I want to ask many other questions, but I think Nitin has already a long list of questions with him. So, I think Nitin, you could just jump in right now and start some of those questions.
Right. So when we talk about infertility, doctor, is it more prevalent in a specific gender? Is it more prevalent in a female or with men?
I think now we have come to a conclusion that men are equally responsible for infertility as are women. And I always give this model to my patients, that understand there are only three things which are responsible: the man for giving his sperms, the woman for her egg, and then the female genital tract has to be normal to be able to conceive that child and let it grow in it for 9 months. So, if these three things are normal, then we generally say that there's nothing which we know of which is causing infertility.
Understood.
Right.
So men
And are
and women
the
are equally responsible, equally. So you
yes, yes,
don't get out of
definitely.
the loop. All men are into the loop as much as women are.
Understood, doctor. And are the causes or the reasons why infertility basically happens in both the genders same, or are they different? Like,
No, no. See, when I tell you that the man has to have sperms which are functional, which can reach the woman's genital tract, then it is important that his sexual function is all right. That means he doesn't have any erectile or ejaculatory dysfunction. Two is that his semen has good number of sperms, they can move well, and they are normal in structure. On the other hand, this is all the man needs to do, nothing more than this. After that, the woman is fully responsible. She has to have an egg which has to be released. Generally, a woman releases one egg in every menstrual cycle. So she releases her egg, and then she has to have a genital tract which is patent, where the sperms come from the vaginal side, the egg comes from the abdominal side, both meet in the fallopian tube and then is pushed into the uterus to implant. So the causes in the men are related to his sperm parameters. The causes in a woman are related to either her ovulation, where she releases her egg, and her genital tract, where she implants and grows a pregnancy.
understood, doctor. And when we talk about causes, I was specifically looking at lifestyle habits. Like I've heard that smoking can cause infertility. And similarly, does obesity work as a risk factor for infertility?
Have you seen the caption written on cigarette boxes?
Right, right.
What can
Yes,
it
yes.
cause? Tell me. Not infertility, it can make you die. So, cigarette smoking is injurious to health, and it can cause anything. And we all understand that, gametes are very delicate structures. They are being made every day. and any high level of nicotine in blood can hurt them. So they can cause infertility. They can cause, in a mother who's a smoker, they can reduce the growth rate of the baby, which is intrauterine growth retardation, and so on and so forth. So smoking is generally has got no good things. You tell me one good thing which smoking is associated with. It is not. So smoking can definitely reduce fertility for men, especially, and for women also, but mostly it affects the growth of the child in women. Apart from that lifestyle, a very fat man or a woman will have difficulty in conceiving. Similarly, a very thin woman might have difficulty in conceiving, because both extremes are bad for the ovulatory function, for release of the egg. So, lifestyle, what else should I say?
Like for example, like today, some couples, and when they're living away from family, yeah, they might be eating a lot of junk food or fast food or aerated drinks, and so would that reduce the fertility of the couple, and especially because many times the age of conception is also increasing since many decades. So, would that be a contributory factor, the kind of nutrition they are having, or the kind of fast food, or other these kind of lifestyle, or stress, for example?
I'm sure what you're saying, Shikha, is all true. Living away from a family and both working, they're so tired by the end of the day that they eat whatever is available. And we know whatever comes from outside is generally junk. Very rarely there are places where you can order in something which is not junk. And junk is bad for health. Once it's bad for our health, how can it be good for reproductive health? So it is very, very closely associated with reproductive health. Two, if they are living on their own, then even sexual sort of frequency becomes very low for such couples. And number three, probably, you know, I think these two factors are very, very important when you talk about eating the wrong type of food, not exercising, lifestyle difficulties because there is lack of exercise. They're all potato couches, sitting on a chair and working all day, and plus not having enough time for even having a sexual contact.
Understood, doctor.
Right.
And what about stress? Stress as a factor.
See, stress is there everywhere. I don't know how much everyone comes and says, am I not conceiving because we are too stressed? You're not conceiving because you're too stressed, because you don't even have time to have a normal sexual contact. That is a very important factor. Otherwise, stress might contribute a little bit, but it's not a whole lot of, component which leads to infertility.
So
If
here
you're
I have
stressed,
a,
yeah, yeah,
sorry, carry on.
no, 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 it's all right.
So over here only I had a question, because a lot of couples, right after they get married, it's almost like a clock ticking, and when within 12 months or after 12 months the baby is not on its way. So a lot of people say, oh, why don't you look at infertility treatment? So what is the right? How does a couple decide that no, we really need help, and this is
There are two ways a couple decides on when they need help. One is when there is a lot of pressure on them through their own minds and their families, that, marriage means to conceive, and that is when the pressure starts coming in. Or they've been very busy and suddenly they wake up to the thought that, oh, it's now 4 years or 3 years or 2 years and we are having unprotected sex and I have not conceived yet. Then sort of this idea dawns that we must go to an infertility specialist. So you see, I have both type of people. Some who come to me after 3 months of living together and say, I've not conceived. And another comes after, say, 4 years and says, we've never bothered, but it's 4 years of unprotected sexual contacts and we've never conceived, and suddenly we thought that there must be a problem. So ideally we say 1 year of unprotected intercourse in a normal woman and man. When I say normal woman, that means she has her menstrual cycles regularly, they have no sexual problems, no coital problems. And yet if they don't get pregnant, if the girl doesn't get pregnant within a year, then we say possibly there is infertility and we need to investigate and see whether there is a real reason causing it or it's just more time required for a couple.
Right. And I have seen also that polycystic ovarian syndrome has been rising a lot, or it's been reported far more frequently. Is there an association between PCOS and infertility? And if yes, then what is the association?
PCOS is again, as you say, a disorder where nutrition has a very, very important role in a woman's life. PCOS is genetic. And like you cannot cure genetics, but you can correct a lot of disorders, like wearing glasses for children. I always tell them that once you start wearing glasses, do you think you will be able to take them off? No. Then I say, so when you are diagnosed as PCOS, think that it's a lifelong management plan. But if you stay within lifestyle limits, you will be able to manage it much better. So we can correct it, we can't cure it. So PCOS is on the rise, correct, because there is a lot of junk available, there is a lot of fast food available, and there is a sector of our population which can go for it. Well, genetically also, Indians are more, it is India is the diabetic capital of the world, and hence PCOS has a linkage with diabetes. PCOS happens more in families where diabetics are there, from generation to generation. So the diagnosis of PCOS is on the rise, PCOS itself is on a rise, and recognition of PCOS has become very common. And that is why I would say almost 15 to 20% of all girls at one or the other stage are diagnosed to have underlying PCOS.
Correct. Yes. Nitin, you're on
Nitin,
mute.
yeah,
Sorry. So as a follow-up on that, I think one of our viewers had asked, what's the remedy for PCOS? If you can,
as I told, it is correctable, not curable. Now, PCOS has certain manifestations. One is that it can lead to very irregular periods. Girls don't get their menstruation for 2 to 3 months, or they have to take a medicine. What is very important, and I want to tell all viewers that please don't think that hormones are harmful. If you don't have thyroid forming in your body, you take that. That's a hormone. So if you don't have progesterone forming in your body, which happens only by ovulation, don't hesitate if the doctor gives you a progesterone tablet for 5 days a month or 6 days a month to induce a menstruation every month. That is so important to prevent cancer of the lining of the uterus later on in life. When you don't have periods for 2 to 3 months, then you've just got estrogen. There are two hormones which work in women, estrogen and progesterone. Estrogen is the one which causes a lot of growth of the lining. Progesterone is the one which slaps it down and prevents cancer. So we have to use progesterone. Don't think that nahi aa raha hai period, never mind. It'll come whenever it comes. We will not take hormones. Please listen to your doctor. Take hormones. At least let your periods come 8 to 9 times a year. That is protective later on for preventing from cancer of the lining of the uterus. So hormones are very good, and us, I would want the viewer to know that if you're not getting regular periods, please take medicines. If you are getting regular periods, be relaxed. That with PCOS, you have got no reproductive problem. All you can do is do a serum progesterone estimation on day 21, 22, and if that progesterone shows you are ovulating, there is no reproductive dysfunction with PCOS. But be careful about your weight, be careful about your diet, because you are a candidate who could later become diabetic, hypertensive, and would have hyperlipidemia or high cholesterol. Shikha, you could throw some light on this maybe for PCOS girls. What diet would be ideal? Because they put on weight very easily because they have high insulin levels.
Yes. So, like doctor mentioned that for polycystic ovary, they have a family history of diabetes, and a lot of people who come to us, to our organization, say, "Oh, we don't, our blood sugars are normal, and therefore don't give us a diabetic diet." But in reality, the carbohydrate insensitivity is there. That means the insulin is getting hypersecreted in the presence of simple sugars or simple carbohydrates. Now, a lot of people say, oh, we don't have sugar, so why would our body have this kind of a problem? The thing is that a lot of people don't realize that suji, maida, corn flour, breads, even brown breads, they are all refined flour, and the glycemic index or the propensity of these kind of foods to raise the blood sugar level and hence cause more of insulin imbalance is there. And even if they don't, even if like a bread is not tasting sweet like sugar, but it is having the same impact as sugar. So a lot of people who come to our organization, actually what we have seen is that that something which are very common. The first thing is that in their normal diet or in their normal food habits, they are very restricted to having only wheat, bread, chapati, and more of these kind of grains rather than diverse grains like ragi, jowar, bajra, oats, or other grains. Now, unfortunately, in modernization, the other grains have been ignored, and most population is eating rice and chapati and bread. But the reality is that's not natural. That's not a normal diet, because this is a convenience diet of convenience, that wheat is easily available, rice is easily available, and that's why it has become a staple cereal. But reality is that if you really need multivitamins and you need multiminerals, the diet has to have diversity. The second reason what we have very frequently seen is that such girls tend to go on cycles of dieting. So in cycles of dieting, they follow a typical low calorie diet. Now, as principally, we are against any kind of calorie association with diets, because it leads the people into just cutting down food, which is another way of starvation. And what it does is it further pushes the body into imbalance and hormonal imbalance. So what is recommended is actually increasing the quantum of food, but changing the kind of food, which means less of starchy food and having more of fiber foods, which could be, again, like I said, ragi, jowar, quinoa, bajra, fruits, salads, things like that. Another association which we have seen is that some people do not respond very well to dairy products. So when we started looking at the whole thing between polycystic ovary and dairy, we realized that maybe it is because of the amount of oxytocin which is being used in industrial uh, farms, dairy farms, because the cow can only give milk once the newborn is born. And to push the tenure of milk producing cow, a lot of oxytocin is injected so that the cow is giving milk continuously and large quantities of milk. And that somehow is also impacting in some ways the hormonal cycles of young girls, young women. And therefore, whenever we stop dairy products and actually replace it with other calcium rich foods like ragi or til, or sesame, til like sesame seeds or other grains, we have seen that the response to the nutrition plan is far better. And also, many times we have seen that because even in poultry farming, the feed which is given to the hen, to the poultry animals has growth hormones so that they grow faster. So what happens is, because growth hormone is given as part of a feed to the poultry in the poultry farm, somewhere it is having some kind of an impact on the hormonal cycles of women. So what we try to do is we try to switch to a balanced diet, which is balanced in terms of protein, carbs, and other nutrients, but it is primarily a plant-based diet. It has less and less of animal products. People who insist on having animal products, then they have to go for organic or free range, in which hopefully there is less or no quantity of all these hormones and other things. The second thing is we also insist on having a lot of vegetable juices in the diet plan. Now, why vegetable juices is because, as we have seen, that many conditions from cancers to allergies to asthma to cholesterol problems, myocardial infarcts, they all start with the inflammatory body ecosystem, or a millennium of the body which is very inflammatory in nature. And having a lot of vegetable juices reduces that kind of inflammatory condition and makes the body, what you can say, more in naturopathy it's called alkaline, but I would say in medicine it would be less inflammatory in nature. So and of course we add probiotics and prebiotics to the diet, so that the body bacteria, which is the first line of defense against all illnesses, whether it is celiac disease or whether it is malabsorption or many other conditions which start from the gut, are also stabilized. So it begins with the looking after the gut, then the liver, and then finally such people will also have to be put into an activity schedule. So, doctor, what I've seen very interestingly is that a lot of people think that we are like steam engines, that we have like food in like coal, and if we run, it is like an engine running and we're burning that coal. So, like we all know that metabolism is completely different from combustion. So we tell people that no, even if you eat that samosa, if you try to burn it off for 2 hours in the gym, it won't work, because samosa is nutritionally deficient and it has those trans fats and other things which will not really help. So do not compare yourself to a steam engine which can burn off any bad food. So that's where we try to educate them also. Yes.
I think a very important point you brought forward, Shikha, was that brown bread is not different from the normal bread. This is a constant thing which I hear, that, I've stopped having white bread and I have brown bread. All they do is put in color over there. All the breads would have some form of maida in them. Even the whole wheat breads do have, but yes, little maybe less maida. So I think our roti, and that also जैसा आपने बताया, all the ragi and the bajra, is makka also very good or no? What do you say
Yes.
about makka?
Yes, so if makka is like, for example, like, many times we give a recipe that what you can do is you can saute vegetables in 1 teaspoon ghee, and you can put beetroot, carrot, mutton, green peas, makka, that is
Okay.
corn, and make it into it looks very colorful. So you have all the colors, and this whole vegetable bowl, we say have at least a big bowl twice a day, preferably, but at least once a day. So what happens is you get all the multivitamins. You also get
And
natural
the
plant.
nutrients, yeah.
Yes, but what we don't suggest is that if you are having only makka by itself and not having other vegetables.
Yeah, yeah, correct. So makke ki roti, which is a very popular thing in North India, and in the winters, sarso ka saag, makke ki roti. So I think that makka does have a lot of carbs. What is your opinion on
Yes,
it?
yes,
Makka
yes, agree with you. Yes, makka has a lot of carbs, so it comes in the category of rice and all.
Yes, yes. So we have to be careful about what we eat. Eat your fill, but eat proper. This is the
Yes,
message which goes from an infertility specialist to a nutritionist. I mean, everyone says the same language.
yes,
Before we move on to other questions, there was one last question about PCOD or PCOS. So the person's asking, do we need to be worried about PCOD even if our family planning is already done?
Well, it's a very important question which you've asked. First thing is, just forget the nomenclature is no more PCOD, which is polycystic ovarian disease. It is not a disease, it is a syndrome. And syndrome means that, it's a cluster of symptoms. So PCOS is a lifelong management plan. It has got nothing to do with your family being completed, because it is a genetic condition. It is going to stay with you. If you've completed your studies, you don't leave your chashma out and say, no, no, now I don't need my specs. If you've completed your family, please remember that PCOS is still inside your body. And this syndrome has only one manifestation in the ovary, which makes the ovary looks polycystic. But then as life goes on, it can predispose you to diabetes, to hypertension, to high cholesterol, and endometrial cancer. So, these are the four scares of PCOS that you have to take care till you enter menopause and thereafter also. So, weight management is a very important component. Even though with weight management you could get hypertensive, but yes, diabetes would become less. By menstruation management, risk of endometrial cancer will become less. By weight management, you will reduce the risk of high cholesterols. At least the triglycerides will be less. Yes, genetically, you could still have hyperlipidemia, and for that, you might have to take medication. So, diabetes, you can sort of prevent. Endometrial cancer, you can prevent. Triglycerides, you can keep down. Family, you've completed, but you still can't leave PCOS unattended till you've reached menopause and beyond that also, because it can lead to hypertension and all the other metabolic conditions I've just told. So don't forget PCOS. Only the reproductive part is complete, so you can forget the reproductive part, but menstruation needs to be taken care of.
There was one last question. There was a question on the diets for PCOS. For the benefit of our viewers, I'm just sharing our app called Vedic Diet. where all the plants are already available. So anybody who's looking for PCOS diets,
I
please
think
use our
Shikha just told us the diet so well that all you have to
right,
do away is by refined carbs and sugars and trans fats. You need the good fats. You can use, I think, I'm sure Shikha will agree, asli ghee or olive oil, drizzle or sabzi made in olive oil, or the nuts, which give us the
Yes,
very good oils. So these
yes,
are the good oils. So we don't say stop fats, but we don't want you to fry fats and use that oil maybe again and again, which is done very commonly where fast food centers are there. So trans fats are bad, but the other fats are good.
yes,
understood,
absolutely.
doctor. I think there was a lot of question about how to improve the AMH level and what is the possibility of
Nothing,
whether there
there is nothing which can improve the AMH level. I know it'll get into an infertility talk if we get indulged into PCOS. AMH cannot improve. It is a marker of the ovarian activity. So all we can see is what is your ovarian age with the help of doing AMH. And if there are two different AMH from two different labs, it is not your problem, it is the laboratory problem. So AMH will always go on reducing with age, slowly, steadily, but nothing happens in 6 months or 1 year. So don't panic if the AMH is low. No drugs will improve it because it is natural aging of the ovary.
okay,
That's
doctor. So
it.
this is a question which is not coming from a PCOS perspective, but somebody who is probably undergoing an infertility treatment, right? And if they want to basically improve their AMH levels, if there are any treatments available for that,
No, there is nothing. It is all in the air. People do use DHEAS preparations, but that's a nutritional agent and it just gives you a better nutrition. Maybe in IVF, some people have, there are few publications which say that DHEAS might improve the egg recovery rate, but please do not go on that. DHEAS or any other nutritional agent or other agents are not going to improve your AMH. So don't waste time on these drugs.
understood, doctor. That's really insightful for our viewers. And also, there was one question before we move on to the other questions on infertility. What is the best way to test whether you are menopausal or not? I'm sure there are women in their 40s suffering from PCOD, PCOS, and confuse it with menopause.
Well, yeah, you could get confused with menopause because if you're not having regular periods, so please do one thing, get a good ultrasound done and look at the ovarian volume, the number of follicles around it. And if you have an induced or a self period, you can do the basal hormonal evaluation and show it to your gynecologist. FSH, LHE2, and a AMH again will tell you that you are still a PCOS and you are nowhere near menopause. So, not having menstruation could be on two extremes. One is when menopause is coming close, then, or when you are a PCOS with a lot of hormonal imbalance, then also you don't have your periods. So the best way, the easiest way is a good ultrasound and the volume of the ovaries. If the volume is on the higher side, say 8, 9, 10 cubic centimeters, you have PCOS, you are nowhere near menopause. But if the volume is less than 3 cubic centimeters, maybe you're going into menopause. And apart from that, hormonal assessment.
Thanks, Dr. Abha. So, I think there was one question about the right treatments which are available. So, can you put some light on the various treatments which are available for infertility and how to identify the right treatment for you?
Well, for the patient to identify the right treatment is very difficult, but I wish more doctors are sort of ethical and they know what is the right treatment. So, in a woman, if she has ovulation problems, then all she needs is medicines for inducing ovulation, and she should be able to conceive naturally, normally. Well, if everything is normal in the man and woman, that means the sperms, the eggs, and the tubes, then we don't know how to reduce her time to pregnancy. Time is passing, everything looks normal, but they are not conceiving naturally. Then what we do is increase gamete concentration in the genital tract of the woman. How do we do that? We increase the number of eggs being released in a cycle. So instead of one egg, we release two or three, but not more than that, because if she really gets pregnant that cycle, she could have multiple pregnancy. So just two eggs to be released or maximum three eggs in a given cycle, so that what happens in three cycles, we pull it down to one cycle. We take the hormones higher. With three eggs, there would be higher hormones also. On the other hand, how do we increase male gamete into her genital tract? We allow her natural intercourse as well as concentrate a semen sample and introduce it into her genital tract very close to where the fallopian tubes are attached to her uterus at the time when we think she has just ovulated or is about to ovulate. And this leads to a good number of women getting pregnant. So, this is known as ovarian stimulation with IUI. So, this is one method. One is medicines ovarian stimulation for ovulation induction. And the last method is IVF, where we don't know why are you not getting pregnant with everything. We take out your eggs, make a lot of them, and take them out, and we take the sperms, put them together, make embryos, little babies up to day 5, day 6, and then transfer one by one into your uterus. And I'm sure most of our girls do get pregnant. Uh, if nothing else very big is wrong with them. So these are the three treatment options available apart from surgical correction of problems which may be there around the uterus, around the ovaries, in the pelvic structures, which can be rectified, and then a woman can, sort of become pregnant easily. So, in short, I could only think of enumerating these four things: one surgical, one medical, and one ART. Medical is ovulation inducing agents for women or sperm increasing medicines. Surgical is correction of pelvic disorders or the passage for the male sperm passing. And last is ART, where IUI is a very simple form of treatment and IVF becomes a high category assisted reproductive technology.
Thanks, Dr. Abha. So, I am sure viewers would have also heard about the whole traditional Chinese medicine for infertility. So, what's your take on that?
Chinese medicine, I have no idea about it. Chinese medicine, you see, China is everywhere. It's there with Corona, it's there at our border, and it is there inside our medical system also. So I really don't know how much to trust it, but yes, there are Chinese herbal medicines, and we all feel that yes, China has a very, very long history of development, and hence our Ayurveda is so important. It has such a big development history, and drugs do work, and I'm sure Chinese medicines would also work. I have no idea about Chinese medicines, or I wouldn't be able to throw light on them.
Thanks, Doctor. Also, I think there was a question on how to improve the quality of ovum and sperm. So, can you just
Good
touch
diet,
upon?
good nutrition, good lifestyle, good diet, that can lead to good quality eggs also. All the cells, even your skin glows if your diet is good, if your environment is good, if the pollution is less. And you, all I say is that exercise every day, very important for girls who are wanting infertility treatment, who are carrying a baby also. Good brisk walk, a little exercise is so important to increase the circulation of the body so that every organ is perfused with fresh oxygenated blood. That is the best way to improve quality of all cells including egg and sperms.
Thank you, Doctor. And are there any food items which are, notorious for causing infertility? Like, if there are certain food items that you should stay away from?
Yeah, junk will not cause infertility, but it will make your health statistics so bad. It will lead to obesity, the wrong type of fat, the wrong type of cholesterol, and all this in turn will make you an unhealthy individual. And in any case, good health is associated with good fertility also. So I would only say that in for infertility, we don't say that any diet will cause infertility, but yes, it may make you unhealthy. That might lead to a little lowered fertility, but otherwise, no diet. Pregnancy, yes, people have fads. Papita mat khao. Bichara, papita has become the dushman of all pregnant girls, whereas I feel a ripe papita has so many good nutrients and it never causes any problem. So it was raw papita, which was sort of said not to be eaten, and it went on to the whole papaya, pineapple, then berries, cherries, everything good was sort of told that they can lead to miscarriages, but that's not true.
Thanks, Dr. Abha. Before we close the session, can you also put some light on what are the various precautions or how to prepare your body if you're planning to have baby in like 2 to 3 years, right? I mean, how do you start the whole preparation?
I think a healthy body has a healthy reproductive system also. So you just have to look after your general health, your weight, your nutrition, your lifestyle. And if your lifestyle is good, then generally reproduction is not difficult. But then there would be a lot of people who would say that, I'm so obese, or I had such a bad lifestyle. I wake up at 10 o'clock, I sleep at 4 o'clock in the morning, and yet I conceive so easily. So there are people who do conceive, but when we look at figures, then the percentage of people with a good lifestyle conceiving easily is much higher than those with a poor lifestyle. So my suggestion to viewers are that it's not only reproduction, it is your life as a whole that you have to look after, and hence look after yourself well. uh, at this time, keep distancing, wear a mask, and mask has reduced so many respiratory infections in Delhi, especially at this time of year where the air quality is so bad. I would fall ill every 15 days, in all these years. Touchwood, God willing, in last 2 months of heavy pollution, also the mask has saved me. So it's just lifestyle, which I would tell all my viewers, that if you have a good lifestyle, don't fear. There could still be infertility. I'm not saying good lifestyle, but that's one component. There could be problems which you have uh, been born with, or which happened while you were living your life, that certain infection happened, your tubes got blocked, or you stopped making eggs, you went into ovarian failure or spermatogenesis failure. All this could happen while as we grow up. But then a good lifestyle will always give you a edge upon those with poor lifestyle towards reproductive function also.
Nitin,
Nitin?
you're on mute. Nitin, you'll have to unmute yourself.
All right, sorry. So I was saying that with that, we'll be closing the session. But before that, I would request both Dr. Shika and Dr. Abha to make closing statement for our
Yes.
viewers to take back.
Yes,
Shikha, you
so
start.
I mean, it's wonderful always to meet Dr. Majumdar, and like always, it's been wonderful listening to you. And I know Dr. Majumdar is so renowned, and so many people have benefited and from her expertise. So thank you so much, Dr. Majumdar, for coming today on the show and on this panel. It was really lovely listening to you.
Thank you, Shikha, for such lovely words. I think you don't even know that I know about your nutritional skills when I started my practice in Delhi, and that was in 2000. It was maybe I started in 87, but since 1991, when you had a clinic somewhere, I think in South Delhi, was it there?
Yes, yes,
I
yes,
used to
yes.
refer patients that there is a Dr. Shikha Sharma. You can go and ask her for a diet. Now I don't have to tell them anything. They find you on the web and you are there. But anyways, this was such a good platform, and I wish we could have spoken more about diet. But then, there are so many infertility questions that they all prepped up, and all I was doing is sorting out their queries. And I wish we can have a talking session sometime where we can address all your questions to all my viewers. I wish we can have a session with all the questions there. But then I myself have questions regarding diet, and I'm so glad to have heard Shikha to tell us what to eat and what not to eat, because fitness is the key to living your life happily as well as healthy also.
Yes, absolutely, and so well said. And I think Nitin, could you also highlight how to reach out to doctor, because a lot of people might be interested to contact the doctor.
Right.
So yes,
So yes, so Sir Gangaram Hospital, they have a separate dedicated website for the IVF section. It's ivfgangaram.in. And if you look for Dr. Abha, the first searches are going to be for IVF website. And on the website, you'll be able to find the contact number. Right? And also there's also an email address. And in case anybody wants to reach out to doctor, you can reach out to us and we will be able to have more than happy to connect you to doctor. Right. So with that, we'll be
Thank you
closing this webinar.
much, Nitin, and I'm glad that you could carry out a medical session so well, whereas I understand that a lot of must be Latin and French to you.
Yes, yes. It comes with the habit now. Thank you,
Yes.
doctor. Thank you for joining us.
Thank you. And I,
Thanks,
Dr.
Dr. Shikha.
Majumdar, look forward to many sessions with you. And we will, of course,
Sure, I loved, and I love this platform of yours. This was so good. It's much better than Zoom.
yes,
Yeah,
it's yes, the video quality is better. So thank you so much, and I look forward to connecting again.